This lecture today is on the directional terms for our anatomy class. If you have not downloaded the term sheet, please go do so right now. Push pause on this video and go do so you can fill it in as you go. Please feel free to pause the video at any time that you need to go over the terms and write down your notes. Tomorrow, bring those tomorrow to class because we will have a quiz and we will have a review on the internet, okay? So this is my model today. His name is Quentin. Okay, first, anatomical position, toes pointing forward, hand palms out, chin up. This is anatomical position. Note, palms out, okay? Not this way, not down at your side, palms out, okay? Stay standing just like that. Okay, so the portion of the body, we're going to go through the planes first. The mid-sag plane runs directly through the middle or median of the body, just like this, right down the nose, right down here. A sagittal plane cut would be cut anywhere like this. So sagittal is this way, mid-sag medial is this way. Now if you're going to cut the body like this, pretend my paper is slicing down him, this would be your frontal plane or coronal slices, okay? This is very important to know as you look at the body, which way you're looking. If you're looking at the organs this way, this would be a coronal cut. If you're looking at the organs from a sideways position, would be a sagittal cut. It's very important when we get to looking at the organs and labeling them, you need to know which plane you're looking at. The plane that comes through the body like this, like you're slicing it like bread, is considered a transverse or axial look. On an x-ray, it would be an axial plane, and it looks like you're just slicing somebody like a slice of bread. Okay, that's very important. Anywhere that you see this is a transverse or axial plane. Okay, directional terms of the body. The anterior portion of the body is the front. Right here, this is anterior. Right here where his back is posterior. So your posterior part is this. Your anterior part is forward. So if you say that your stomach is anterior to your kidneys, or your gluteus maximus muscle is posterior to your pelvis, those would be some directional terms that you need to be familiar with. Also, you'll need to be familiar with distal and proximal. Distal means away from the midline of the body. So distal, your fingertips are distal to your elbow. Another one would be proximal. Your knee is proximal to your ankle. It is closer to the midline of your tummy. That's very important to know as we look through the structural anatomy when we start looking at bones. Medial and lateral. These are very, very important, and we're going to use the hand right here to go over medial and lateral because this is a very difficult concept. The lateral portion or the outside part is the thumb. The medial portion of your hand is your pinky or your fifth metatarsal. Okay? So your fifth phalange, I'm sorry, I said metatarsal, that's a phalange. So your fifth phalange here, this is medial, this is lateral. And the reason why is this little bump on your wrist right here on my model, is your ulnar styloid, and it is on the lateral side. And your medial side is your radius. Now, if you roll a hand over, the radius will fall over the ulna. So you must keep it in anatomical position in order to be able to label it properly. Okay? Okay, we're going to go over some that are the same. Like dorsal, some people will say dorsal. That is the same as posterior, means towards the back. Or ventral is towards the front, anterior. Some people still use those terms. If you see them, you should be familiar with them enough to know that they mean the same thing as posterior and anterior, okay? So go over those. Superior and inferior, okay? Superior means above, inferior means below. The head is superior to the neck. The pelvis is inferior to the rib cage. Simple, need to know that. The other terms would be cranial or caudal. If you say, please move cephalic cephalic towards the head, or caudal towards the feet. I said cranial. Cephalic and cranial are the same term. Cephalic and cranial mean the head. So towards the head, towards the feet is caudal. So if somebody says, please move your hand cephalic 5 degrees, please move your hand caudal 5 degrees. It's used a lot in medical terms. It's also used when you start looking at your imaging or when you start looking at the body and the positions it lays. Now, we're going to have our model here do a little movement. When somebody is laying on the ground on their tummy, this is a prone position. On the tummy, hands out, prone, face down, bottom up. Now, if somebody is laying on their back, this is a supine position. You need to know where your organs are if they're laying in a supine or prone position. That is a very important things to know. Okay, go ahead, stand up. We're going to go over the 9 abdominal regions of the organs. We're going to use a little marker here so you can kind of see. Okay. I'm going to make sure I get it correct by looking at the diagram and matching it with my model here. Okay, so you have 9 regions of the abdomen. Okay, his rib cage ends here, and his crest of his pelvis ends right there. Okay, so this region is, what hand is this? Is this your right hand? Okay, right. And this is left. Very good, model, right and left. So this is your right hypochondric region, which this is your cartilage, sits right underneath your rib cage. Okay. This is your epigastric digestive stomach, right in here. And this is your left hypochondric region. This is your right lumbar region. Towards the back is your lumbar, your umbilic right there, and your left lumbar region. Okay? And this is your hypogastric region. Okay, it sits right below the belly button. This is your left again, iliac region, and right iliac region. Now we're going to go over the organs tomorrow in class. That's in each one of these. So if you want to get a head start and want to Google some of that, you're more than welcome to. But the one question I'm going to ask you, on your right iliac region, what do you think a pinpoint pain, what symptoms do you think that would be of what procedure would have to be performed? So think about that. That's a question we're going to ask tomorrow. We'll see how many people have the answer and have it correct. So our model here, we need to thank you and make sure you download all of those term lists, get them filled out. Tomorrow we're going to do a review, go over the organs in the 9 regions, and we will also do a quick quiz in class and make sure everybody is good with all of the terms that we've discussed today. All right, thank you.